Hey everyone, so now we'll be starting with part 4 where we'll be dealing with some more instruments. So here we'll be starting with needle. So we have 18 gauge needle that is commonly used. Then we have Foley's, which is also 18 FR, and we have nasogastric tube. This is usually 14 FR. So just remember this roughly. So this is the minimum gauge needle that is used in trauma, like advanced life support. In advanced life support, we'll be using this. Now, coming to color codes and volume, velocity, and all. So let's start like this: color, then we have size, then we have flow rate. So to remember, let us do it in some new way. So color orange, so something related to it will be yellow. Then we have gray, then we have white, then we have green, then we have pink, then we have blue, yellow, and violet. So starting with green, 18, then orange will be 14, and yellow related to it will be 24, and white 17, and gray 16. Now coming to pink, it will be 20, and blue 22, then yellow will be 24, and violet 26. Coming to velocity, 10, 20, so add ending digits 30, then you will be getting 50, 80, 130, 210, and finally 270. Next we'll be seeing the color codes of other tube as well. So here we'll be having color, then size in French. So for Foley's and NG tube we'll have same coding. So for this is the coding. Now we can remember like this: Gori from Punjab. So green, then orange, red, yellow, purple, and blue. So coming to this sizes, so 14, 16, 18, 20, 22, and 24. So these are the sizes. Now what will be the contraindications? So contraindications will be skull base fracture and esophageal strictures. So these will be contraindications. Coming to length of NG tube, just remember necks and Nemo. So necks means xiphoid, nose, ear, and xiphoid. It is used in adults, and for children it is Nemo, which means nose, ear, and mid xiphoid and umbilicus. So if we can't insert NG tube, if it is contraindicated, then we'll be doing percutaneous gastrotomy. So it is endoscopic. Through mouth we'll be sending tube, and then we'll put one hole, and we'll pull it out through the stomach. So this is how we'll be doing percutaneous endoscopic gastrotomy. So next we'll be discussing about daycare anesthesia. So daycare anesthesia. So what are the criteria like to call a surgery a daycare surgery? What has to be there? So surgery has to be less than 2 hours duration. Then also low risk surgery. It has to be a low risk surgery, and post op complications has to be immediate, and less risk so complications has to be there. Patient is able to eat and drink post operatively. Patient is able to mobilize, like they are able to move. Post op pain is managed by painkillers along with LA block. Also, BMI has to be less than 38. So if these things are present, then criteria for daycare surgery is met. Now coming to contraindications. So contraindications will be ASA staging 3, then 4 and 5, and comorbidities, that is poorly controlled comorbidities, and ASA 3 has to be unstable, then it is contraindication. Now coming to next part. So what is the preferred anesthesia? So preferred anesthesia will be total IV anesthesia. So IV anesthesia is preferred, for which we'll be using propofol, and preferred opioid will be remifentanil, which is shortest acting, and it is metabolized by plasma cholinesterase. Coming to muscle relaxant. So muscle relaxant will be using succinylcholine or rocuronium greater than mivacurium. And most common complication cause for readmission after surgery will be post-op nausea and vomiting or hemorrhage. So these are the complications and few points you have to remember. And one more extra point is Aldrich score is score for discharge. Basically it takes into account activity, BP, then consciousness and respiration and O2 saturation. So these are the points considered in Aldrich score, and we'll be seeing in next part 6. Okay, thank you.